comprises of 4 bones, 2 innominate bones, 1 sacrum and 1 coccyx. Each innominate bone has 3 components, the ilium, ischium and pubis. The ilium is a large flared out part. When you place your hand on the hip, it rests on the upper border of the ilium called as the iliac crest. In front of the iliac crest is the bony prominence called anterior superior iliac spine, and a shorter distance below it there is the anterior inferior iliac spine. Similarly, on the posterior side there are 2 similar points, the posterior superior iliac spine and the posterior inferior iliac spine. The concave anterior surface of the ilium is the iliac fossa. After the ilium, we will learn about the ischium. The ischium is the thicker lower part. The larger prominence is called the ischial tuberosity, on which the body rests when we sit. Behind and a little above the ischial tuberosity is the ischial spine. Next is the pubic bone. It forms the anterior part of the pelvis. The 2 superior rami and inferior rami join to form the pubic bone. At the joint is the pubic symphysis, which is having a pad of cartilage. The 2 inferior rami form the pubic arc. Now we will learn what is the obturator foramen. It is a space enclosed by the body of the pubic bone, the rami and the ischium, and this is called the obturator foramen. The next is the acetabulum. The acetabulum is formed by the contribution of the innominate bones of the ischium and of the innominate bones in the form ilium 2/5, ischium 2/5 and pubic bone 1/5. These form the acetabulum. The function of the acetabulum is that it receives the head of the femur. On the lower part of the innominate bones are found 2 curves. First is the greater sciatic notch. It extends from the posterior inferior iliac spine to the ischial spine. This is the greater sciatic notch. It is wide and round. The lesser sciatic notch lies between the ischial spine and the ischial tuberosity. This is called the lesser sciatic notch. Now we have dealt with the 2 innominate bones. The next is the sacrum. The sacrum is a wedge-shaped bone consisting of 5 fused vertebrae. Upper border of the first sacral vertebrae, just forward, is known as the sacral promontory. The anterior surface of the sacrum is concave and is referred as wing or ala on both the sides. The posterior surface of the sacrum is roughened to receive attachments of muscles. 4 pairs of holes or foramen pierce the sacrum posteriorly. 1, 2, 3, 4. 4 pairs. Through this, the nerves from the cauda equina emerge to supply the pelvic organs. The last bone is the coccyx. The coccyx is a vestigial tail. It consists of 4 fused vertebrae forming a small triangular bone. It is a movable bone. The joints. 4 bones. Similarly, there are 4 joints. So 4 bones connect at 4 joints, all of which allow varying degree of movement. There are 2 sacroiliac joints. 1, 2. There is 1 pubic symphysis joint and 1 sacrococcygeal joint. The pubic symphysis is formed by 2 pubic bones united by a pad of cartilage. The sacroiliac joint is the strongest joint. It joins the sacrum to the ilium, thus connects the spine to the pelvis. The last is the sacrococcygeal joint. It is formed where the base of the sacrum articulates with the coccyx. In non-pregnant state, there is very little movement. But during pregnancy, endocrine activity causes the ligament to soften, which causes joint to move. This provides more room for the fetal head as it passes through the pubic symphysis. The pubic symphysis may separate in the later stage of pregnancy. The structure. Next is the structure of the pelvis has two main divisions, the false pelvis and the true pelvis. The false pelvis is the part of the pelvis situated above the pelvic brim, innominate bones and limited by the iliac crest. The true pelvis is the bony canal through which the fetus must pass during birth. Parts of the true pelvis: the pelvic brim, the pelvic cavity and the pelvic outlet. First is the pelvic brim. The pelvic brim is round except where the sacral promontory projects into it. The promontory and wings of the sacrum forms the posterior border of the pelvic brim. The iliac bones form the lateral border and the pubic bones form the anterior border of the pelvic brim. The pelvic cavity extends from the brim above and cavity below. The anterior wall is formed by pubic bones and symphysis. Posterior wall is formed by curve of the sacrum, which is 12 cm in length, and lateral walls are the sides, which are mainly covered by obturator internus muscles. This cavity is circular in shape and is 12 cm. The last is the pelvic outlet. Here there is an anatomical outlet and an obstetrical outlet. Now we will learn about the landmarks of the pelvis. There are in all 9 landmarks. The first is symphysis pubis, pubic crest, pubic tubercle, pectineal line, iliopubic eminence, which is rough as you can see, and the iliopectineal line. Then is the sacroiliac joint and the anterior border of the sacrum, that is the ala. And the last 9th is the sacral promontory. The first is the diameters of the pelvic brim. In that, the first is the antero-posterior diameter. It is the line from the sacral promontory to the inner margin of the upper border of the symphysis pubis. It measures 11 cm in length. In this, there are 3 conjugates. The first is the anatomical conjugate. It is a line taken from the sacral promontory to the uppermost point of the symphysis pubis and measures 11 cm. The obstetrical conjugate. It is a line taken from the sacral promontory till 1.25 cm lower to the posterior border of the surface of the pubic symphysis. 1.25 cm below and measures 11 cm. The last is the diagonal conjugate. It is a line from the sacral promontory to the lower border of the symphysis and measures 12 cm in length. The next is the oblique diameter. It is a line drawn from the sacroiliac joint to the iliopectineal eminence on the opposite side of the pelvis and has a 12 cm diameter. So this is the oblique diameter from the sacroiliac joint up to the iliopectineal eminence and is 12 cm in diameter. The last is the transverse diameter. It is the line between the points farther apart on the iliopectineal lines. On the iliopectineal line, this is the transverse diameter. And is 13 cm. The diameter of the pelvic cavity is 12 cm in length, and since it is circular shape, so it is 12 cm completely. So now we saw the diameters of the pelvic brim, diameter of the pelvic